Good evening, this is Dr. John Adams. This is a review of an article in Forbes by C.J. Arlotta entitled, Should Physicians Prescribing Opioids Be Confident in Managing Chronic Pain? And in this, Mr. Arlotta points out a few interesting points. In a study noted by Haymarket Medical Education Global Medical Education website, it was noted that only 25% of physicians who are certified to prescribe opioids believe they are very confident in their skills to manage patients using those drugs. One of the contributing factors for this low level of confidence that was noted was little to no training focusing on safe opioid prescribing and management in medical schools and residencies. On down in the article, it was noted that physicians also may feel uncomfortable prescribing or denying opioids because they don't have the tools to effectively communicate the issues of misuse with their patients, and there are limited access to other treatments for chronic pain. There was a great deal of focus on the number of hours of continuing education, but it was noted that it's less about how often the physician should take continuing education and more about the importance of developing the knowledge and skills to competently prescribe opiates. Some of the techniques physicians are using to give more thorough and competent prescribing practices of opiates include documentation in patients' medical records, patients' prescriber pain agreements, prescription monitoring programs, and patient education as well as communication tools. Despite all this, however, it seems that the patients are not fazed by the country's growing opioid epidemic, or at least safe opiate prescribing isn't a priority for them. It's noted that while they may understand that others may become addicted or overdose, they are in denial about how this risk may apply to themselves. And many patients don't appreciate that opioids have limited efficacy for chronic pain and may not be the best treatment for everyone that suffers from chronic pain. The results of this survey indicate that 75% of the physicians surveyed did not feel confident in chronic management of opiate medications. This should be concerning to patients since these medications do carry significant risk, including respiratory suppression and possible death, among others. Consideration of a consult or long-term management with a board-certified pain management specialist, or at least a physician who has experience and training in the appropriate use, management, and discontinuation of chronic opiate medications. Additionally, the ability to provide non-opiate options for chronic pain management is necessary, since the evidence is somewhat limited in the long-term benefit of opiates for chronic pain management, particularly as a sole treatment. Other options such as interventional pain management options, physical therapy, clinical psychology and behavioral medicine options, biofeedback, etc., can be considered and often play a part in a well-planned multidisciplinary approach to chronic pain